and we're working on that at a level that people would be amazed. These are incredible people. They don't stop. This method also has been used for more than a century, and that's the blood-related therapy, more than a century to fight off infectious diseases. So it's not unusual. Our level of uh, complexity has changed, but it's a concept that's been used for a long time, including during the Spanish flu epidemic. And that was really a pandemic of proportions like, frankly, nobody's seen until what we're facing now. That was in 1918. You know what the result of that was? Probably from 75 to 100 million people were killed. And also other viruses like the one in this outbreak. This is a very tough one. This is a tough one because it spread so quickly, like nothing we've seen. It spread so easily, so quickly. We're unleashing every tool in our nation's vast arsenal, economic, if you look, medical and scientific, military, homeland security is working very, very hard with all of them in order to vanquish the virus. As you know, every level of government, state, local, and federal, is working nonstop to obtain more personal protective equipment for frontline workers. We're delivering vast orders of this material. I'm going to ask a couple of the people here to join me that both make it and deliver it. Joining us today are the leaders of America's largest distributors of pharmaceuticals and medical equipment, including McKesson, Cardinal Health, Henry Schein, Owens & Minor, Medline, FedEx, and UPS. We just concluded a very productive meeting about ways to keep our supply chains and delivery systems moving at top speed. And maybe I'd like to just ask for a couple of minutes for Mike Kaufman to come up, and maybe Ed Paseka. Mike is with Cardinal and Ed is Owen & Minor. But I appreciate, and if anybody else has anything, please come up. But if you could come up, Mike, for a second, and Ed for a second, just you could maybe say what you told me before when we had the meeting. Thank you.
Thank you, Mr. President, and thanks for your leadership on this. Because of that leadership, we have really seen the government agencies working with industry like no time before. We've seen HHS, FEMA, the CDC work incredibly effectively with all of the distributors, and all of the distributors working together for the good of the people. And all of us have been so focused on making sure that we take care of our customers, because our customers are the ones that are taking care of the patients every day, and we need to do everything we can to make things good for them. And so it's been great to see how well all these government agencies have been coordinating together with us. Thank you.
Thank you, Mr. President. Let me first start by thanking the administration for all the support you have provided to the industry. You know, one of the things we did hear the challenge, and starting in January, we've ramped up our production in the Americas, including our facility in North Carolina, where we are now manufacturing an additional 40 to 50 million masks per month to get into the U.S. healthcare system. And we talked a little bit about this in the pre-meeting. One of the issues we're struggling with is the demand increase. You know, used an anecdotal example of one hospital in New York that traditionally uses roughly 10 to 20,000 masks a week are now using 200 to 300,000 masks a week. So you multiply that times the entire U.S., let alone the same demand outside of the U.S. That's part of the issue we're running into, is even with a significant ramp up in supply, you know, there's still that demand that is much greater than that supply. Thank you.
And I bring that up because when we discussed back in a room, we were in a conference room, very nice one actually, it's called the Cabinet Room. That statement was made that they've been delivering for years 10 to 20,000 masks. Okay, it's a New York hospital, it's packed all the time. How do you go from 10 to 20 to 300,000? 10 to 20,000 masks to 300,000, even though this is different. Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? How do you go from 10,000 to 300,000? And we have that in a lot of different places. So somebody should probably look into that, because I just don't see from a practical standpoint how that's possible to go from that to that. And we have that happening in numerous places. Not to that extent. That was the highest number I've heard. That's the highest number you've seen, I would imagine, right? But this man makes them and delivers them to a lot of hospitals. He knows the system better than anybody, and I think you were more surprised than I was when you saw that number, so thank you very much. I hope I didn't get any of your clients in trouble, but it could be that they are in trouble. So they have to look at that in New York. FEMA is working with these companies to launch Project Airbridge to expedite the movement of critical supplies from other countries to the United States. The first flight arrived at JFK Airport, New York this morning, filled with 80 tons of personal protective equipment, including 130,000 N95 respirators. Those are the ones that we were talking about before. 1.8 million face masks and gowns, 10.3 million gloves, and many other things. Millions and millions of different items. FEMA has scheduled 19 additional flights and is adding more daily. We hope to have about 50 flights. We're going to have, I think, including the one that came in today, we're up at 51 flights with these massive planes from the different companies that were so nice to be here today. Would you like to say something on behalf? Please come up. Thank you.
Thank you, Mr. President, for the incredible leadership. I will share with you that UPS is really proud to be part of this effort. Vice President Pence and I had the opportunity to speak before, and the way we're going to win this war is with great logistics, and UPS is going to be part of that effort. We have a big brown army, 495,000 UPSers across the country that are ready to deliver. We're bringing in the supplies from anywhere around the world as fast as we can so that they can serve the communities that need them most. We're proud to be partnering with the states as well, because we know that in partnership with those states, we can deliver what is needed everywhere. So thank you, Mr. President.
Thank you. You're doing. Please. Thank you very much.
Thank you, Mr. President. I would certainly like to echo my colleagues' comments that the collaboration amongst many of the government agencies and the private market, the distributors represented here today, has been incredible. It's been increasing and ramping up over the past weeks. Today's first delivery of Operation Airbridge, I think, is the first evidence that it's working. The 51 flights you referenced, we're excited about. We look to build upon that. So I would echo my thanks for your leadership, and certainly to the staffs for the terrific partnership and the commitment to protect the people we think about most often, which are the people on the front lines providing care. And maybe just a quick word of thanks on behalf of all the CEOs here to our teams that continue to show up in warehouses across the country, in pharmacies across the country, and do their jobs to keep the supply chain going. The supply chain is working, it's resilient. Supply is a challenge, we're tackling that.
Thank you very much. Great job.
Thank you, Mr. President, and thanks to FEMA and HHS. I think great leadership, and it's really working well. The demand has skyrocketed, and we're doing a lot of things to bring in more masks, more other protective apparel. We are involved in reprocessing masks, and we've already started at about 100,000 masks per day, and we hope to expand from there. So we're quite optimistic about it. Thank you.
Fantastic job. Anybody else, if you want? Yes, please. You're doing such a great job, we have to let
thanks.
everybody if they want.
Thank you, Mr. President. We appreciate the opportunity to work with your administration on a lot of collaborative fronts. Number one, we've all talked about PE products. That's critical, and it's not just to the hospitals. That's a must, but it's really to all healthcare providers out there working on the front line. So our commitment is there to get it to the hotspots and get it to the care providers that are taking care of those patients. It's absolutely key. Second, we talked in there about buying in America and getting resources back here and manufacturing in America. That is critical, a lesson to be learned from where we are. And lastly, we're proud that we introduced a test. We need to get some more tests out there in a rapid form. We're excited about that. We've worked with your administration very closely in the FDA, and we're very grateful for that because it's a quick, rapid antibody test that needed as well. So we're really proud to work with your administration. All going well. Thanks so much.
Thank you. So thank you all very much and for the great job you're doing. It's really incredible, frankly. Many of the states are stocked up. Some of them don't admit it, but they have. We have sent just so many things to them, and including ventilators. You know, there's a question as to hoarding of ventilators. Some hospitals and independent hospitals, and some hospital chains, as we call them, they are holding ventilators. They don't want to let them up. We need them for certain areas where there's big problems. Can't hold them if they think there might be a problem weeks down the road. So we've delivered a lot, and this group has been really fantastic. We want to thank you. And, UPS and FedEx, in particular, you've gone absolutely out of your way, so we appreciate everything you've done and delivered. The federal government continues to mobilize every resource to make sure our frontline doctors and nurses have the equipment needed to save American lives. Yesterday, I visited Naval Station Norfolk as the USNS Comfort departed for New York 3 weeks ahead of schedule, fully loaded with 12 operating rooms, 1,000 hospital beds, and hundreds of the best doctors, nurses, and medical professionals anywhere in the United States Navy, anywhere, frankly, in the United States. It was an incredible thing to see. Most of you saw that on television as it was leaving. It left literally 3 weeks early. It was under maintenance, and they got the maintenance done very quickly. They worked round the clock, as many of the people have, and it was a great sight. Additionally, two of the country's largest health insurers, Humana and Cigna, are announcing that they will waive copays, which is a big deal for anybody that understands insurance. They don't waive copays too easily, but we've asked them to do it, and they've done it. Co-insurance and deductibles for the coronavirus treatments to help ease the financial burden on American families during this pandemic. So they're waiving copays, co-insurance, and deductibles. I don't think anyone's heard of that one. Have you heard of that one before? I haven't heard. I want to thank them. Great companies. Today I spoke with Wolfgang Puck. Wolfgang Puck is a great restaurateur, as you know, as is Jean-Georges and Thomas Keller and Daniel Ballou and other leaders in the restaurant business, which has been probably one of the hardest hit industries. I've directed my staff to use any and all authority available to give restaurants, bars, clubs incentives to stay open. You're going to lose all these restaurants, and they're not going to make it back. They have to get going. So what I'm doing is I'm going to tell Secretary Mnuchin and also our great Secretary of Labor, who you know very well, to immediately start looking into the restoring of deductibility of meals and entertainment costs for corporations. That set the restaurant business back a lot when it was done originally and then done not so long ago. And we're going to go to deductibility so that companies can send people to restaurants. I think it'll have a tremendous impact and maybe keep them open. I mean, don't forget, some are closing right now, despite the fact that they could be open in the not too distant future. We expect that. But there are some that aren't going to be able to get open, and we want to make sure they do. So we're going to look at the restoring the deductibility of meals and entertainment costs for corporations so that corporations can send people to restaurants and take a deduction on it like they did in the old days. That was when restaurants were doing really well. The financial relief bill I signed on Friday provided historic relief for American workers and small businesses that includes $350 billion in job restoration and retention. So if you look at job retention loans for small businesses, that's a big deal, with loan forgiveness available for businesses that continue paying the workers. So it's $350 billion. Job retention loans for small businesses with loan forgiveness available for businesses that continue paying workers. I mean, how about that? $300 billion in direct cash payments are being sent to every American citizen earning less than $99,000 per year, $3,400 for the typical family of four. So they'll be getting a check for $3,400 for the typical family of four. Approximately $250 billion in expanded unemployment benefits. Under this plan, the average worker who has lost his or her job will receive 100% of their salary for up to 4 full months. The bill provides for these unemployment checks to be delivered through the existing state unemployment systems, not us, state. And I was opposed to this method because many of the states have very antiquated computer systems that are 45 years old, and they're not prepared to handle this kind of distribution, this kind of money coming in so quickly. They're not set up for that, and I didn't want to do it, but our opponents wanted it, so we did it. And if they don't get their money fast, I'm going to ask that we convene the federal government, that we come back to Congress, and we'll do something where we take care of it, because we can take care of it very easily and quickly, and I said that. But a lot of these systems are so old and so antiquated at the state level that they have the money, they're going to get the money very quickly, but they're not going to be able to distribute it. So remember what I said, and we will, if we have to, call Congress back or find some other way of delivery of the money. Throughout this great national struggle, the American people have embodied the unrivaled patriotism and willpower that has led America to conquer every challenge, every single one in our nation's history. More than 90% of Americans say they are staying home as much as possible, putting their lives, their careers, their educations, and their dreams on hold out of devotion to their fellow citizens and to their country. Social distancing, that's the way you win. These shared sacrifices are pulling our nation together like never before. Family bonds are strengthening. Neighbors are looking after neighbors. It's incredible. I'm seeing, you're seeing, everybody's seeing what's happening. Communities are rallying for the cause, and all divisions are fading away. The Americans of every background are uniting to help our nation in this hour of need. It's up to 151 countries. So when we say our nation and the world, when you think of it, 151 countries. Somebody said to me today that wasn't in this particular world, they didn't know that we had that many countries. 151 countries, that's something. And some are struggling at a level that nobody would have believed possible. If you look at Italy, if you look at
Hi,
France is
Zacchaeus.
having big problems. Spain
There's
is
my
having
big boy.
incredible problems. Something we did very well is
He
when
says,
we
I don't
stopped
want the
inflow
virus
from
around here, Dad.
China at a very early level. That was a good thing to do, great thing to do. We would have had thousands and thousands of more deaths. And we also stopped the inflow from Europe at a very early level. But those things were very important, especially the initial one, because we had never done anything like it, where we closed our borders to a country like that. The modeling put together by Dr. Birx and Dr. Fauci and our other top healthcare we have, and these people are amazing, the healthcare experts who in this country are the best in the world. They demonstrate that the mitigation measures we are putting in place may significantly reduce the number of new infections and ultimately the number of fatalities. I want the American people to know that your selfless, inspiring, and valiant efforts are saving countless lives. You are making the difference. The modeling estimates that the peak in death rate is likely to hit in 2 weeks. So, I'll say it again. The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines that our great Vice President holds up a lot. He's holding that up a lot. He believes in it so strongly. The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread. On Tuesday, we will be finalizing these plans and providing a summary of our findings, supporting data, and strategy to the American people. So we'll be having lots of meetings in between, but we'll be having a very important statement made on Tuesday, probably Tuesday evening, on all of the findings, all of the data, and the reasons we're doing things the way we're doing them. we can expect that by June 1st, we will be well on our way to recovery. We think by June 1st, a lot of great things will be happening. I want every citizen in our country to take heart and confidence in the fact that we have the best medical minds in the world tackling this disease. We have the best science, the best researchers, and the best talent anywhere working night and day to protect your family and loved ones and to overcome this pandemic. With the grace of God, we are rising to the occasion. We are proving that no darkness can overshadow the eternal light of American courage. We will win, and when we do, we will rebound with astonishing force and speed. We will be stronger than ever, and we will have learned so much where something like this can never hurt us to the extent it has, and the world. Again, in our present crisis, the strength of our people is our single most important asset, and together we will defeat this invisible curse, this invisible enemy, and rise to incredible new heights. So I just want to thank you all for being here, and we'll take some questions if you'd like. Yeah, please, Kelly.
Million cases in the United States and deaths could exceed 100,000. Do you accept that assessment, and has that formed your thinking about extending these guidelines? And you also talked about New York. Were you suggesting there has been inappropriate use of masks or improper conduct with supplies?
No, I want the people in New York to check Governor Cuomo, Mayor de Blasio, that when a hospital that's getting 10,000 masks goes to 300,000 masks during the same period, and that's a rapid period, I would like them to check that, because I hear stories like that all the time. You know, we're delivering millions and millions of different products, and all we do is hear that, can you get some more? But when you hear that, and I heard that from one of the great companies of the world at doing this, it's a client. And they're going from, you heard it, 10,000, 20,000 tops to 300,000? And that's a hospital that's always full. So I think people should check that, because there's something going on. Well, it's not, I don't think it's hoarding. I think it's maybe worse than hoarding, but check it out. Check it out. I don't know. I think that's for other people to figure out. But you don't go from numbers like that. Now, other equipment likewise, because we're delivering a lot of ventilators. And we're building, by the way, we're building and buying, and we have a lot of ventilators that we're going to be sending out very soon. We also have right now in the stockpile almost 10,000 ventilators that we have to hold in case of emergency. We don't want them going out, and then Louisiana has a tremendous problem, which we now know they do. You know, all of a sudden it came very quickly. Louisiana was doing so fantastically well, then all of a sudden it was a big rash of cases. So we have to be prepared to move the ventilators. Are very important pieces of equipment. They're very expensive, and they're very complex. It's like building a car. You know, these are expensive, complicated, very complicated pieces of equipment. So we now have 10,000 in, and we inherited a system which was broken. Just like, I'll never forget the day when a general came and said, "Sir, my first week in office, we have no ammunition." That was in the military. We've now rebuilt our military, stronger than it's ever been, and we have so much ammunition. You wouldn't believe it, how much ammunition we have. But the same thing here. We had a stockpile that was deficient. We had testing that was no good. We had a testing situation that just wasn't right. It was okay for very small cases, but it was obsolete and it was broken, and it was only good for a very small situation. But what I'd like to do is I'd like to ask Dr. Fauci to come forward and discuss the number, because I think the number is going to be a very different number than the numbers that you talked about. Please, Doc, you might talk about that.
Yeah, thank you, Mr. President. Yeah, the number I gave out is, based on modeling. And I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number. Yeah, it's possible. I mean, you could make a big soundbite about it, but the fact is, it's possible. What we're trying to do is not let that happen. So instead of concentrating on the upper and the lower, we're saying that we're trying to push it all the way down. But the second part of your question was, yes, we feel that the mitigation that we're doing right now is having an effect. It's very difficult to quantitate it because you have two dynamic things going on at the same time. You have the virus going up and you have the mitigation trying to push it down. But the decision to not prolong, but to extend this mitigation process until the end of April, I think was a wise and prudent decision. Dr. Birx and I spent a considerable amount of time going over all the data, why we felt this was a best choice of us, and the president accepted it. So, in direct answer to your question, the idea that we may have these many cases played a role in our decision in trying to make sure that we don't do something prematurely and pull back when we should be pushing.
So thank you. You all know you've all seen the models. You've seen the models from Imperial. You've seen the models from Columbia. We've reviewed 12 different models. And then we went back to the drawing board over the last week or two and worked from the ground up, utilizing actual reporting of cases. It's the way we built the HIV model, the TB model, the malaria model. And when we finished, the other group that was working in parallel, which we didn't know about, HIME, and Chris Murray, ended up at the same numbers. So if you go on his website, you can see the concern that we had with the growing number of potential fatalities. All of the flu models predicted anywhere between 1.6 and 2.2 million fatalities if we didn't mitigate. I think you all knew those numbers. Some of them predicted half of the United States would get infected and have that level of mortality. So we worked very hard together to really look at all of the impacts of the different mitigations that have been utilized around the world and use that evidence base to really bring that data and that evidence to the president to consider for extending, which is not a simple situation when you ask people to stay home for another 30 days. And so they have to know that we really built this on scientific evidence and the potential to save really hundreds of thousands of American lives. And we know that's a huge sacrifice for everyone. We know it's a sacrifice for every mother and child and father who's also self-isolating. There are people that have to go out to work, and we know the compromises that they're making, but it's all to protect not only Americans, but the healthcare providers. The healthcare providers that are on the front lines, and you've seen them, and you've seen how difficult this has been. And so we're really working. There will be a comprehensive piece presented on Tuesday that really talks about not only diagnosing individuals, but also increasing our surveillance now that we have more test kits so that we can really stop and contain new infections. At the same time, we're really dedicating test kits still to the critical diagnosis so people can get the treatment that they want. And so that we can ensure as when people come to the hospital that they know that the nurses and the doctors and the equipment that they need will be there to serve them. Because together as Americans, we're going to bring down the number of infections so we don't have 2.2 million deaths or 1.6 million deaths, but really work very hard to keep this in the lowest numbers we possibly can.
I just want to reiterate, because a lot of people have been asking, well, what would have happened if we did nothing? Did nothing. We just wrote it out. And I've been asking that question to Tony and Deborah, and they've been talking to me about it for a long time. Other people have been asking that question. And I think we got our most accurate study today, or certainly most comprehensive. Think of the number, 2.2, potentially 2.2 million people if we did nothing. If we didn't do the distancing, if we didn't do all of the things that we're doing. And when you hear those numbers, you start to realize that with kind of work we went through last week with the $2.2 trillion, it no longer sounds like a lot, right? So you're talking about, when I heard the number today, first time I've heard that number, because I've been asking the same question that some people have been asking, I felt even better about what we did last week with the $2.2 trillion. Because you're talking about a potential of up to 2.2 billion, and some people said it could even be higher than that. So you're talking about 2.2 million deaths, 2.2 million people from this. And so if we can hold that down as we're saying, to 100,000. It's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job, but 2.2 up to 2.2 million deaths, and maybe even beyond that. I'm feeling very good about what we did last week. Yes, please, go ahead, please.
President, given that you're announcing that you're extending these guidelines, was floating Easter a mistake, do you think? And
No.
does this, can you tell us why? And
It
then
was just an aspiration. We actually will be hitting, potentially, this was with our meeting before, on Easter, we probably, well, that could be a peak, that could be a peak period, that could be the peak, sadly to say, that could be the peak number of deaths before it starts coming down. No, that was aspirational. We had an aspiration of Easter, but when you hear these kind of numbers and you hear the potential travesty, we don't want to do anything where, you know, we don't want to have a spike up. We don't want to do it soon, and then all of a sudden you go down, you're coming down, and then you start going up again, because we discussed that can happen, and we don't want that to happen. We've gone through too much. So that was an aspirational number. I didn't say Easter. I said it would be a great thing if we could do it by Easter, and we know much more now than we knew 2 or 3 weeks ago. Easter should be the peak number, and it should start coming down, and hopefully very substantially from that point. Okay, thank you. Please. Hear that 2.2 million people could have died if we didn't go through all of this, and now the number will be, you know, a much lower number. We should want this to end. This is about death. So I want to thank Cigna and Humana. Thank you.
Will the federal government be reimbursing those insurance companies, or is this something they really are just doing out of their pocketbooks?
They haven't asked for reimbursement, so I assume they're not. They said they're going to waive them. Waiving them doesn't mean we're going to waive them and get reimbursed. No.
Okay. And second question for you, sir. First of the month is 3 days away. I know these cash payments are coming. Treasury Secretary Mnuchin said today about 3 weeks they should get there. For people that are worried about paying rent, I know mortgages through the HUD is taken care of, but I'm just curious about rent. What should people be doing for the first
Well,
of the
they're
month?
going to be getting the money. I will tell you, I think landlords are going to take it easy. We may put out a statement on that. I think a lot of people that are owed money are going to take it easy. They don't sort of have a choice. But a lot of concessions are made, just like the insurance companies. A lot of concessions are being made that wouldn't have even been thought of 3 weeks ago. Not even thought of. So a lot of really positive things are happening. Please, behind you.
Thank you, Mr. President. Yesterday, why did you publicly threaten quarantine on New York, New Jersey, parts
I
of
didn't do
Connecticut?
that at all. Read the statement. Read the statement. Read what I said. I said we're going to look into possibly quarantine. I didn't say we're going to quarantine. I looked at it as a possibility because a lot of our professionals suggested quarantine. I said we're going to look at it. We then looked at it. You see, who are you with, Bloomberg, right? I can't imagine that. Let me just tell you, I didn't threaten it. I don't go around threatening. What happened is people, professionals, very good professionals, love the idea of doing that because that's sort of the ultimate in distancing. You can't do. They didn't want New Yorkers where they're having a problem necessarily going down to Florida where they have less of a problem. So the concept of quarantine was thrown out to me. Really would love to do it. They would love to do it. And I thought it was too much to do because the people are doing a great job with it. Also, it's very hard to enforce.
But
Okay,
by
please.
speaking about it publicly, I mean, by speaking about it publicly and letting it be known that it's a consideration, do you think that you maybe frightened some
No, I
Americans?
think we made people aware to stay in your houses and do good. Now we did an advisory. It's a strong advisory. The governors are running the advisory, the 3 governors, New York, New Jersey, Connecticut. And I think we did a great thing. But all I did yesterday, as you know, and you can see it, you can read it, you can read, and you can see very simply that I said that we are looking into it. And then before the end of the evening, substantially, we decided to go with the advisory, which frankly I liked better from the beginning. Go ahead.
Thank you, Mr. President. I have 2 questions. The first is, you've said repeatedly that you think that some of the equipment that governors are requesting, they don't actually need. You said New York might not need 30,000. You said it on Sean Hannity's Fox News. You said
You know,
that
why don't you people act? Let me ask you.
You said
why
some
don't you
state-
act? Why don't you act in a little more positive? It's always trying to
My
get
question
you.
to you
Get you. And you know what? That's why nobody trusts the media anymore.
My
That's
question
why
is, how is that going to
excuse me,
impact?
you didn't hear me. That's why you used to work for the Times and now you work for somebody else. Look, let me tell you something. Be nice. Don't
Mr.
be
President, my
threatening.
question
Don't
is-
be threatening. Be nice. Go
My
ahead.
question is, how is that going to impact how you fill these orders for ventilators or for masks?
It's
Your
not gonna
views that
impact.
you're not going to, it's not going to
We're
impact you at
producing
all.
tremendous numbers of ventilators. We're doing a great job on it. Mike Pence, our vice president, has headed up the task force, which has been incredible, the job they've done. We have everybody in the White House working on it. We have everybody in the country is working on this in one way or the other. The fact is, we've done a great job of delivering. You've seen the biggest people in the business. I mean, there's nobody even close to this.
Unfortunately, the media wants, some in the media, I should say, want controversy constantly. It's shameful.
A fantastic job. I'm just saying this, if they're holding, let me give you one example. We sent thousands of generators to New York. They were put into a warehouse, a New York warehouse that happened to be located, interestingly, in Edison, New Jersey. They were given to New York, and we then went to other places, also giving thousands of ventilators. The people in New York never distributed the generators. We said, why didn't you distribute them? Now, you have to understand, they have New York people working in those warehouses. They knew they had them. So we said, why didn't you distribute them? I hope they've distributed them now, but maybe they didn't need them so badly. But just so you know, we're all, you, me, everybody, we're all on the same team. You know, when journalists get up, and you're a journalist, a fine journalist, when journalists get up
Sean Hannity.
and ask questions that are so threatening.
I was quoting
we're
you
all on the
directly
same
from
team.
your interview with Sean Hannity.
Take a look at my interview. What I want to do is, if there is something wrong, we have to get to the bottom of it. When I hear face masks go from 10,000 to 300,000, and they constantly need more, and the biggest man in the business is like shocked. He knows all about the virus, by the way. He's not surprised by that. He knows all about it. He shouldn't be surprised. He should say, well, that's standard, because this is really a very tough disease. This is really a very tough virus to handle. Okay.
Mr. President, my second question.
Gee whiz, this lady don't know when to quit.
That's enough. That's enough. That's not fair to your other reporters. It's not fair. You had a long time, a long question. If we have time, I'll get back to you for your second question. Is that okay? All right, thank you. I appreciate it.
Thank you, Mr. President. Just to follow up on previous questions, you said that the peak will hit in 2 weeks.
Well, we don't know that, but we think the peak will hit.
You think it will hit in 2 weeks?
That is our two doctors here.
Can you just share with us your understanding of how bad it will be so the American people will be prepared for it?
Well, I can. I think I'll ask Doctor and Doctor. Maybe you could both come up and give your opinion on that, because that's really...
And I have another question on Italy, please.
Thank you. I mean, we have great concerns when you look at the model. As I told you, look at the Chris Murray model, where he shows a rapid escalation, and you can see it happening, that the people we're losing every day throughout America, and you can see it going up, just like cases, and we're starting to lose people at the same rate, and we have deep concerns about that. And I think we're meeting and we've had calls with the clinicians, and that has been extraordinarily helpful. I think you're watching the alerts. I mean, we have a different population than Italy or Spain. And so because of that, our doctors and our nurses are getting information back really quickly so that they can talk to each other about how to really combat this. We're seeing things here that weren't reported in other countries. And so I really want to appreciate, I know Dr.